Okay, so it's good to see you again today, John. We're going to talk about putting it all together, the nuts and bolts of hormone optimization. What the visit looks like. Last week
Yes.
we did inflammation, and we talked about diet. Today we're going to do some hormone stuff. Okay, but first I wanted to talk to you about. I had this interesting request. I had a letter of medical necessity to go to an insurance company for a patient that we had that had insulin resistance. And his blood sugar was 96, I think, total. And no, it was 103 fasting. And he had clear signs of insulin resistance. And we gave him a supplement called Synergy, Cinnergy. You can see it here on the name of it on the screen here, and it contains a number of ingredients. And the reason I want to bring it up is because it's something that I don't usually do, but he I pulled out the labs that we did for him from where we started, and we'd had three visits when they asked for this letter. So it was pretty remarkable, actually. So he came to us on September 6, 2023, and he had blood sugar spikes and insulin dysregulation. He had a history of alcoholism and hypogonadism with some depression and poor libido. So that's why he came to see us. So they asked specifically for Synergy, which is this combination from it's from Numedica. It's one of my favorites, actually, and we use this in our weight loss program for as a kind of a sweet tooth killer. It
Huh.
works pretty nicely, 4 capsules, and it pretty much shuts down any type of sugar cravings. Um, okay, and it's a cinnamon extract. That's the main ingredient. And it's for helping to control blood sugars and improve insulin function. Here's the
There's all,
ingredient.
but it has chromium in it too.
Yeah, it has magnesium, zinc, chromium. This is the formula. This just came
Uh-huh.
in the package insert. It's got some ginseng in it, alpha lipoic acid. We use that for a neuropathy, um, and a green tea, which actually will boost testosterone a little bit. And Gymnea sylvestre. This is the main ingredient that sort of caught my eye. This is what we want to use for our
Yeah.
um, a sweet tooth killer. Now you can get it. We have some from Now. NOW is a company. They always have that orange label. If you've seen them, um, and as a standalone with just Gymnea on it in it. We like that one. We like Now company because their manufacturing plant is here. It's in Sparks, which is a Reno suburb. So we try to help the locals when we can. Uh,
Sure.
it's got cinnamon in it and then some fenugreek also. All right. And I put here the proof is in the pudding.
What
So
does fenugreek do?
it actually improves conversion of insulin to it improves gluconeogenesis is what it does.
Okay.
Okay.
Mhm.
All right. So, I mean, here is fasting blood sugar, fasting insulin, insulin resistance, which is a calculation, and hemoglobin A1C. So this was his original. He was 103. His fasting blood sugar, his fasting insulin was 13. So normal, as you know, fasting blood sugar, as you can see here, 65 to 99. Normal is 2.6 to 25 on the fasting insulin, and our goal here is usually less than 5. That's kind of our goal.
Got
Insulin resistance is a calculation. It's the fasting insulin times the fasting blood sugar. Divide that by 405. That'll get us to the proper units. And we want that our goal, actually, it should say normal is less than 2.9, and our goal is less than 1.9.
Okay.
And then hemoglobin A1C, I just use, the standard less than 5.7. So here he is, 103, 13. If you do that calculation, you get 3.3. Our goal is less than 1.9, so more than double where we want to be, and 5.4. 3 months later, the fasting sugar went from 103 to 100. Well, not that much of a difference, but his insulin went from 13 to 8,
Uh-huh.
and the insulin resistance went from 3.3 to 1.97. And he and remember, and our goal here is 1.9. Okay, so went from more than double to almost our goal. Okay,
Yes.
6 months later, the fasting sugar is now 67.
Wow.
His insulin is 6. The insulin resistance is 0.99, and then the hemoglobin A1C stayed the same. Okay,
Did he lose weight?
yeah, he lost about 10 pounds.
10 pounds.
Yeah.
Not a whole bunch.
No, no, he really wasn't overweight. Um, but I remember his testosterone, I think, was 245, and now it's at 680. So, it's all a package. It's not just one thing.
Gotcha. Say that again. What was that last lab?
His uh, his total testosterone was 245,
Okay.
and I think and it was 680. So it was 245 here at 9.96, 380 here in May 2nd.
Wow.
Okay.
Wow.
All right. The
Did,
other
did
thing,
he quit drinking? Had he quit drinking at this point?
yes, he stopped drinking. Yeah.
I mean, already before he started with you.
He quit drinking right about when he started with us.
Okay. All right. Gotcha.
A lot of times when these guys show up at our place, this is what happens is, all of a sudden the light bulb goes on, and they start going out for a walk, they stop drinking, they stop beating the kids up, and it's the kind of a come to Jesus moment for a lot of these guys.
Excellent.
All right. The other thing to look at is remember, triglycerides are the first to go in the lipid panel with blood sugar abnormalities,
Yes.
right? So here he is. 148. This is total cholesterol, triglycerides, HDL, LDL. So the total
Gotcha.
cholesterol is not too bad. I mean, that looks pretty good, although the HDL could be a little bit better. Okay. And his
Yeah.
triglycerides are 115. Again, not abnormal, but high, right?
Yeah.
All right. They went from 115 to 53.
Wow.
Right. Now, again, like you said, it's a whole lifestyle. It's not just one thing. But with this, this was our intervention as far as blood sugar and lipid control. And
Hmm.
that's pretty impressive.
That's amazing.
That's pretty good.
Yes.
You can't, I'm sure metformin, you might get this, you might not.
No.
But, this stuff costs 25 bucks, probably last you about 2 months.
And that's all he's wanting coverage for? Is that?
Yeah. Yeah.
Okay.
That's what they asked for. So, don't tell them anything that they don't want.
Yes.
So, um, so I thought that was interesting. This is kind of a real life thing. This is our patient. This is what we did.
Have they responded?
And I don't know.
I see. Okay, cool.
Yeah,
Very nice.
I'm sure if they did, they said, well, we don't care. It's good for you. A pat on the head.
Yep. Yep. Fascinating. No, that's great stuff.
Yeah. So, really impressive stuff. And so it's more than just, I'm giving you a lot of what we do is we're giving you the theory,
Yes.
but here's the proof in the pudding, really. So, I was, again, I don't do this, because, this takes a lot of time, all that often, but I think, it's someone who might be interested in doing something like that, gone through the records and pulling out, because we've used this stuff for years. This guy's just, the reason I did it is because, he asked for it. But, I've had patients on this stuff for 3-4 years, and, they come in. I can usually compare their recent labs that they came in for this time with the last time, and occasionally I'll go back to when they started if they've been with me for a while. But
Fascinating. That's
again,
great.
again, I think that's really, pretty impressive. So, okay.
It sure is.
All right.
Amazing.
Any questions or any what's doing in your world?
A positive thing. A couple of years back, I had been asked to be a medical director for a clinic that has some nurse practitioners. It's actually owned by a guy that is a paramedic,
Hmm.
but he's just a real entrepreneur. And he started out doing testing for COVID, and then just turned it to a business. And he had a medical director, and anyway, he's had various medical directors. He asked me to be a director, and I said, "Yeah, I'm pretty interested." This was a couple of years ago. Well, something got stuck in the snake oil, and his prior relationships didn't want to leave, and they renegotiated, and so he's been with them for a couple of years. He called me and wants me to be his director. Now, he's pretty aggressive. He has some has a nurse practitioner and a PA, and they both do functional medicine. They do PRP. um, they they've got some interesting protocols. They actually do some stem cells and some exosomes.
Hmm.
And I said, okay. I said, listen, number one, I'm in El Paso, but I do have a partner in Dallas. And I said, you know, they'll pay 2,000 a month for directorship. And I said, I've got a partner, but he's more conservative than I am. If he asked you not to do exosomes and stem cells until he was ready, would you do that? And he said, yeah, I think so, because it's really a pretty small part of our
Hmm.
organization. So my business friend is meeting with him today.
Okay.
And the idea is that, okay, we get a clinic up and running and making money, or at least not losing money. And then I can join for a little bit of nothing
Hmm. Okay.
and start. He's not as skilled at functional medicine. We can look over what they're doing and what they're advertising and how it's up and running and successful, and we can draft off of that. We can learn from it,
Hmm.
and he can teach us stuff, and we can teach him stuff. So I'm excited about that.
Okay, that's good. What happened to
Yeah,
the lady when we first started that you were supposed to partner with? What happened to her?
yeah. She just got cold feet. She thought I was going to come in and take over her practice, and I'm obviously not. I'm not interested in doing that. But she's doing hormones. We're still friends. She asked me for advice from time to time, and I
Hmm.
still go to her. She does my hormones, and she's my doctor.
Hmm.
Um,
Okay.
and so she's still working.
So
And yeah,
what have you noticed anything when you're dealing with someone like that's sort of contrary to what we do?
what do you mean?
Um well, like so what she's doing for you is it any different than what we've been advocating? I mean,
Uh,
everybody's got their own style, of
oh,
course.
that's right. That's right. No, so she has a traditional family practice that is slowly turning to functional medicine. So she does probably, uh, 70% of what you're doing.
Hmm.
Uh, but she still charges insurance. And then she's kind of right in the middle. She really needs to commit to the cash base,
Yeah.
and she'll do fine. She just
I, I, I
scared
remember
to.
I tried holding on till about 4 years ago, and then I had enough with the insurance. And let me
Oh,
tell
you did. It was
you,
only 4 years ago, huh?
only 4 years ago I gave up the insurance. And let me tell you, from the day I said that's it, no more, it's been a pleasure.
It has been.
I mean,
Well,
they still bother us, I do these letters for these letters of in the medical necessity, and you should see some of the letters we get when they reject things, especially testosterone for women. You don't see what they write. I'm a moron. I know nothing. Why are we even bothering, with this? Females don't need testosterone.
really,
Yeah.
really,
Yeah.
they're that bad.
Yeah. So I have a letter that if you remind me, I'll send it to you. I have a letter that I think it's in my office computer. I have a letter that I use I call it the snark letter. So,
But that's loaded with
oh yeah, it has 37.
articles.
It's 4 pages long. It's got 37 references in the 4 pages. I mean, it's all facts, but it's like perhaps you should revisit your protocols and bring them up to the at least the year 2000, stuff like that.
Yes, yes. Good for you.
Yeah.
Excellent.
Yeah. Okay. So we're up to hormones, our favorite, of course, right?
Yes.
And this is sort of the meat and potatoes of what we do. And I always say, somebody asked me what I do is that so we look at everything, as you know, through what I call a hormone centric pattern. Um,
Do
and
you think overall, especially come menopause, that that's really true?
Yeah, well, think about it. So what do we talk about when we talk about menopause? Hot flashes, night sweats, brain fog,
Yes.
right? Belly fat.
I think it is too. I really do. I
Mhm.
mean, so much shit
I
happens
mean,
at menopause.
we talk about just about every system,
Yes.
and we go through the history. It just seems like we're not, yeah, because it's got a sort of a different focus to it.
Yes. Okay.
Okay, so a lot of this you've already seen. I mean, like I said, this is just a summary. Why we look at hormones create homeostasis. They carry messages from the organ of origin to the end organ cells, and they regulate everything, right? Hunger, emotions, energy balance. They maintain equilibrium. They're the juice of life. And a body depleted of hormones is sort of like I call it like the caterer not showing up to the wedding. We can call out for pizza, but it's not quite the same, right?
Okay.
Right. So if you're on your own and you're out there, in the postmenopausal world, sometimes things don't work quite the way they should, right? At least not like we were when we were in our 20s,
Yes.
right? So let's go next. Okay, these are all the hormones that we look at. Well, these are the hormones that are around. We don't measure a lot of them. Sometimes I think I'm going to start looking at, say, melatonin, and we've started measuring spot urinary iodine levels. So
Uh,
that's new. Maybe even since we went over the thyroid. Um, you know, uh,
and if they're not excreting iodine, then we need to give them supplements.
exactly. Yeah.
Okay.
Yeah. There's we're all iodinophobic because we were taught it was a poison, and that's a whole story in itself. But this is just a sort of schematic of we're going to look at all of these. Okay,
Yes.
we measure 10 of them. Aging is hormone loss. Whoever made us played a cruel trick on us. We peak it between age 25 to 27. And if you go someplace where there's, not a whole lot of care, like Africa, you're old when you're 50.
Yeah.
When I was in Kenya, the lifespan for a female was 52 and males was 46. Now, some of that has to do with the fact that the official AIDS rate from the Kenyan Health Ministry was 40% of the adult population. But we just assumed everyone had it. Just made it easier.
AIDS.
Yeah,
I
yeah,
see.
it's like rampant over there. That was 2007, so I don't know if anything, what if anything's changed because I never don't really pay attention too much.
Gotcha.
Um, and it affects everything. So, And our goal is to sort of like, shuffle on off the buffalo, feeling as well as you can for as long as you can. This is how the hormones sort of fall off as we mature. And you see
Yes.
there's a steep drop in estrogen here, usually between the mid 40s and mid 50s, and a steep drop in progesterone. But make sure one of the keys is that the progesterone falls off at least 5 years before the estrogen. And so we see a lot of in the hormone world, they're young ladies between 35 and 50 who show up in perimenopausal symptoms, that they went to their doctor, they went to, they went to the psychiatrist, and they got Prozac, and they got Valium, and they got the Xanax, and they got the antipsychotic medications if they're really good, if they're really in bad shape. And so progesterone. And remember what the progesterone symptoms are: agitated, irritable, can't sleep, poor libido, headaches, short tempered. They're kicking the dog, they hate the husband, they're beating the kids up. And then they come in and they say, and I don't even know why.
Mhm.
There's a classic All in the Family. I'm sure you remember Archie Bunker, right?
Yes.
Right. And when Edith goes into menopause, I mean, it's if you go, you probably get it on you find it on YouTube. It's
Yeah.
hysterical, right? Archie turns around, she starts screaming at him and carrying on, and she's fanning herself, and Archie, she tells her she's going through the change. Takes her to she's going through the change, and he turns around and looks at her. He says, "Okay, you got 5 minutes. Change." So, all right. So we want to manage the hormone decline with I call ease and grace. And the benefits of hormone optimization, I probably don't need to tell you. You already know now, muscle tone, sex drive, weight control, better sleep, better hair, better, metabolic profile, and improved skin tone, for women especially, decreased risk of heart disease, night sweats, hot flashes. Um, and remember the world that Women's Health Initiative, um,
Yes.
did everyone a disservice because again, with hormones, it's a knee-jerk reaction instead of thinking about it. All hormones are bad. We had to stop them, right?
Right.
And kept saying, wait a minute, it was synthetic hormones that were bad. The natural hormones didn't have those effects. No, 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 it's all the same. Right? Right. So slowly over the last 20 years or so, the big pharmas come out with um, you know, bioidentical hormones that are useful, but and a lot of times are quite expensive. So there's an oral testosterone undecanoate, which is quite effective. And we were always taught again, oral testosterone causes liver cancers, really, but that was the synthetics. The oral natural one doesn't. But the problem with it is it's 2 to 3 times a day, and it's $800 a month.
Uh-huh.
But
Gee.
but they'll give you a coupon, and then you can get a copay, and you go through that whole baloney, right?
Right.
So there's also a natural nasal spray, testosterone. Um,
Uh-huh.
again, you need to do that like 3 times a day, and it's also $800 a month. So I mean, they're fine, but they're just not practical. Now, I don't know if you go to Canada or Mexico or when I don't want to put it on tape where we got our ivermectin from when it was forbidden overseas. We'll just leave it at that. But
Yes.
then you're taking a chance because you don't really know what you're getting. Um, I got a box and it says ivermectin on it with a little label, and then the pills are just white. I swear I don't think there's anything in them. I think they're just. I never had them analyzed, but.
Listen, living on the border like we are,
Mhm.
um, I can't tell you the number of people that I work with that don't have insurance,
Mhm.
will go across the river to
Right.
Juarez and get their medical care.
Hmm. Yeah,
And it,
yeah, I know. Well, I didn't do that. I was down there. I was in McAllen for 9 months, right around when the anthrax business was going on.
yes, mm-hmm.
We would go over to Reynosa, and same thing from McAllen, and we would get Cipro. We got 20 of them. They were sitting right on the counter there at the almost free pharmacy for $12.95. That was in
Why,
2001. So
why were you down there?
I went
Were you
to
vacation?
I took some classes at UT Pan Am,
Oh,
and
oh,
that yeah in Edinburgh.
uh-huh.
I think they call it something else now, but I'm not sure. Um, and I had a lady friend that moved down there. She was in some Teach for America program. She was teaching special education people.
See, cool.
So I went there and took some classes. I was there for a couple months, 9 months, I guess. And then one of my old secretary's sons was a baseball pitcher, and he was in the minor leagues, and he played for the team in Edinburgh. So he lived with us too.
Oh yeah.
uh,
No, they have a lot of teams down there.
yeah,
It's called the Grapevine League or something like that.
yeah.
Yeah,
I think it was like A ball maybe or double A. I'm
yeah.
not. And I don't think it was double A. I think it was A. Anyway, he hurt his arm. He ended up with that Tommy John surgery. Never got to the big leagues,
I see.
but he was there. I think he was there for about a year and a half, I guess. So
Wow.
I was there for 9 months. So I think he played 1.5 seasons down there. So
So you
it was
you
nice.
took
It was nice in
classes.
the winter. I mean, it was really nice in the winter down there. In
Yeah,
this
and
summer,
you
you could.
worked down there. Did you
Huh?
get it? Find a job?
I worked in like a clinic on the on the side.
I see. Okay, cool.
Right. My Spanish wasn't too good, so it was, yeah. I guess you're pretty fluent in Spanish if you're down that way.
Getting better. Yes, I'm getting better.
So, yeah. So, yeah, I kind of liked it. And summertime, and the winter was great. And the winter
Yeah.
was nice, and the summer was awful.
Yes.
Yeah, the bugs were as big as my computer screen. And, yeah, yeah. To do anything outside, you had to be done by 7 a.m. and you couldn't go back out until after 9 at night
That's right.
down there. Is that El Paso that way too?
Pretty hot. Yeah. Although it cools off at night now. It's cool.
Yeah.
It was 39 degrees the other day when I woke up. So
Yeah. Okay. So again, bioidentical versus synthetic hormones. And bioidentical hormones are exact copies of self-structure of hormones as they're produced by the body. They're derived from plant extracts. And again, there's pharmaceutical companies are making estradiol patches now. Prometrium was the progesterone that came out in 1998. Um, there's not a real good a natural testosterone. They're not they're again they're all synthetics. They have to make it the drug companies have to make it a unique product. So that's the problem. If they can't patent it, I don't know. I guess they can't patent natural testosterone. They have to make it, and so they make it into a pill. They make it into a nose spray. There's an underarm deodorant one. I forget what the brand name of that one is. Um,
interesting.
yeah. So, and then androgel, I guess, is and that's a synthetic. So we try to stay away from them. I have 3 patients on androgel. I probably have over 1,100 male active patients. I have 3 on androgel. Guess what their profession? They're all the same profession.
Doctors?
Doctors, exactly. And not only doctors, they're all specialists. One's a psychiatrist, one's a neurologist, and one's a hematologist. The hematologist is the one I really argue with. I said, "What's the matter with you?" It's, I said, "Joe truck driver gets it, and you don't." Okay, so
Oncologist. Did you say oncologist?
yeah, hematologist, yeah,
Hematologist. Yeah. Okay, cool.
yeah. This is from that Fournier study, that European study that I showed you a couple of times, estrogen and synthetic estrogen, synthetic progesterone, 69% increased risk of developing breast cancer in women who never took HRT. Synthetic Premarin alone causes an increased incidence of heart attacks and strokes, and synthetic progesterone increases breast cancer, heart attack, and dementia risks. Um, did I tell you about my secretary's daughter? She was 18, um, and I might have told you that. She's
Tell
18
me.
years old, and my secretary, no, she wasn't my secretary, she was my nurse. This is in the late 80s. Um, she was very religious. She was extremely religious. She was the vice president of the church, and everything really by the book. Okay, and the reason I bring that up is you know it, is because the daughters, she had two daughters that they had adopted from South America. And these girls were extremely attractive, and they didn't look like Northeast Pennsylvania is Eastern European stock, um,
Uh-huh.
Polish, Slovak, Romanian, that sort of ethnic background. That's the major. That's at least it was. I haven't been there in 10 years. I don't know if it's changed, but anyway, that's the way it was. Anyway, so these girls, when they showed up, I mean, they had dark black hair, and they had sort of a little bit darker skin. And these girls were just absolutely gorgeous. And the older one started not feeling well, and she started having thyroid symptoms. Her hair started thinning out and getting brittle, and she started gaining weight, and she was tired, and she was having trouble getting out of bed, and she was having trouble seeing, and um, we didn't know what we know now. But I remember her TSH was high, so I sent her to the endocrinologist, and they put her on Synthroid even then, and she was one of those that failed, and it just didn't nothing worked. They took her to the Mayo Clinic. I think they even took her to Stanford or big medical centers, um,
Uh-huh.
and they really didn't come up with anything. And she wasn't
Interesting.
doing well, and she went from like a straight A student to a C, and she instead of going to college, she ended up working at a 7-Eleven, and her life just was not going well. This went on for about 2 years.
Gotcha.
And I used to take off on Friday afternoons. We used and started to do paperwork and then go home. And I remember it was a Friday afternoon, and it was in the winter there. And winter in Wilkes-Barre is not exactly the greatest weather. And there was a knock on the door, and it's Angela. So I was, "Oh, Angela, how are you doing?" And it's my nurse's daughter, and she goes, and it was Good Friday.
Uh-huh.
Okay.
Wow. Okay.
It was the perfect storm. Okay. So she comes in, and she says to me, she says, "Dr. Clearfield, can you do me a favor?" And I said, "Sure. What do you need?" She goes, "Oh, well, Planned Parenthood is closed today, and I need my birth control pills renewed, but you can't tell mom, right?"
Yes.
And I looked at her and I said, "Birth control pills?" She goes, "Yeah." I said, "How long have you been on birth control pills?" She goes, "A little over 2 years." And I said to her, "When did you start taking them?" And we sort of pinned it down to it. And I looked up her, in her, and remember, we had paper charts then. We didn't have computers. So I
Yes.
pulled out her record, and it was like 6 weeks after she started taking the birth control pills that the thyroid symptoms started.
Wow.
And so I went through the whole thing with her with the birth control pills. And I said, "You got to stop these." I said, that's what, no, no, that's what she goes, "No." I said, "Angela, that's what's doing it." So she did stop it, after a little bit of kicking and screaming. In 2 months, all the thyroid symptoms were gone.
Wow.
2 years, who knows how much money we spent, $100,000 on tests,
Yes.
specialists and whatnot, right? And I never told mom. So yeah, I can keep a secret. Now it's on video. But so That was 1988, 89,
As
probably.
things say, you were in Wilkes-Barre. That's a long
Yeah.
time ago.
Yeah. That was 1988 and 89. How long was that? 30 some year, 35 years ago. She was
Wow.
18, so she'd be about 53 now. So I don't know ever whatever happened to her. That was mom left. She became the a full-time church lady, and I saw her a few times after that, but since haven't seen her at all. So um, okay, so the point is, stay away from synthetics. Okay, and you're going to get. If you do start doing this work, you're going to get from insurance companies. Well, we gave the patient medroxyprogesterone. It's the same thing. No, it's not.
Yes.
And if you remind me, I'll send you. It's like I said, I have letters. All you have to do is put the patient's name in, put in their diagnosis and dates,
Okay.
and all of the meat and potatoes is there. It's got all footnoted and all. So okay. So,
Yes.
all right. So here's the hormones. You should know them by the back of your hand by now. Here are the seven. There's no, I did this. I made this sort of distinction myself. There's not a real reason for it, although, the ones on the left are the ones we deal mostly with. It just helps me sort of organize them in my mind. Um,
Gotcha.
okay. You've seen this before, the steroidogenic pathway. I know it looks busy and whatnot, but again, probably if you've been doing this long enough, and if you start seeing patients, it'll start getting easier and easier. And you'll have this in your mind. Cholesterol. There's that star reaction, converts to pregnenolone. And then if you go over to the right here, you got DHEA, androstenedione, testosterone, aromatizes into estradiol, and 5-alpha reductase goes into dihydrotestosterone. Um, and the other pathway goes to estrone. There's the three metabolites. The 2-hydroxyestrone is the safe pathway, and the 4 and the 16 are the danger zones. You can get that on a urine test, that Dutch test, if you
Yes.
get the metabolites. Um, and 17-hydroxyprogesterone will convert to cortisol and cortisone. If we had a 3D picture, remember cortisol and thyroid are interrelated. So if this was a 3D, picture a pencil coming right back at you from the cortisol, and that's where your thyroid pathway comes from. And then
Okay.
just remember, I know we've touched on it briefly, the cerebral or psychiatric issues deal with progesterone and it's not on this chart. That can convert to dihydroprogesterone, similar to testosterone to dihydrotestosterone to allopregnenolone. Allopregnenolone is the hormone that generates GABA, your calming neurotransmitter. And so,
Yes.
I've talked about it a couple of times. Your 5-alpha reductase inhibitors, finasteride and dutasteride, that block testosterone to dihydrotestosterone, also block progesterone to dihydroprogesterone in the brain. And you can get, in a small subset of patients, you can get pretty severe psychiatric issues um, uh, uh, from that. So you need to make sure you're careful. Okay.
Okay.
And
Gotcha.
it sometimes happens with one pill. They take one
Huh.
pill and they're in it, and they don't get, and it can be permanent. So um, it's called the post-finasteride syndrome. So, and we have a whole lecture on that. Um, here was one of my first forays into AI. I might have showed you this before, and as you can see, it spells words wrong. I kind of like the picture, so I throw it in there. So,
Yeah.
so okay. So this stuff you should know by now. Testosterone, it's an anti-anxiety agent. It's an antidepressant. It's useful for strength, energy, sense of well-being, mood, cognition, muscle tone, urinary incontinence. In women, urinary dribbling, in men, sexual energy, sexual desire. It protects against mitochondrial dysfunction. That's a big term, they like to throw around these days. It moderates anorexia nervosa. Okay, again, anorexia nervosa, you think low testosterone. it's an anti-inflammatory, particularly low back and knee pain, and it follows along the kidney and the kidney pathway. If you know anything about Chinese medicine and the Chinese meridians, okay, testosterone actually alleviates the symptoms of kidney deficiency in
Hmm.
Chinese medicine. It increases interleukin 10, which is an anti-pro-inflammatory cytokine. When it's low, again, so we have fatigue, depression, anxiety, suicide ideation. Testosterone is one of the key hormones that gets depleted in traumatic brain injury.
Mhm.
And the measurement within 24 hours after a traumatic brain injury, and it doesn't have to be a major one. It could be just a bump on a mild one, which is 75% of the brain injuries, can be up to 80% of patients have a 50% or greater depletion of testosterone within the first 24 hours a,
Wow.
yeah. Okay. Loss of muscle tone, lack of muscle coordination, balance, loss of confidence, and again, sex drive and lack of orgasms. Testosterone is more than just all you see on TV is it's sex, but it's more than that. It's a universal. And when you see these crazy people saying, men are over testosterone, and we have to, we have to get rid of this toxic masculinity. I mean, what do you think you're doing?
I think the opposite. I think that we're getting feminized, to be
Exactly.
honest.
Well, yeah, but there's endocrine disruptors.
Yeah,
Are This is the same chart actually. The same thing,
I
just
see.
different colors. So I got to fix that up. Okay, so what do you need to watch out for? So these are the issues that develop with testosterone. Okay, um, so the thought that increased oxygenation somehow contributes to sleep apnea, and then sleep apnea contributes to lower testosterone levels is sort of a two-way street. Um, and the naysayers say, well, if you have sleep apnea, you shouldn't be on testosterone. And if you ask them why not, you get kind of a shrug of the shoulders.
Hmm.
Okay. But too much testosterone, you can get acne, you can get gynecomastia. You will get erythrocytosis, particularly with the injectables versus the transdermal. Um, you can get a little bit enlargement of the prostate. I think we've debunked some of the other myths, though, that prostate cancer, cardiovascular disease, and strokes. I had a patient. Did I tell you about the guy 2 weeks ago? He called me and he had a superficial phlebitis in his arm. And
Hmm.
he had a lumbar laminectomy, and then ended up with a superficial phlebitis in his arm, and the surgeon told him it was from the testosterone.
What?
Yeah. Well,
Goodness sakes.
let's so I
Had nothing to do with the IV that he had.
well yeah, so here's the story. First of all, it was a failed surgery. Okay. And this was his third surgery. And he used to be a runner, an athlete. And now he barely gets around the house, and he can't work, and he's extra, just to go out and take a walk around the block is that his day's shot. Um, and he can't feel his feet. He's got, a peripheral neuropathy. That's number one.
Yes.
He's gained like 30 pounds. We're doing what we can for that. That's number one. Number two, he tells me when they put the IV in him for the surgery, he says, it's all kind of hazy because they were giving him anesthetic. He said it was hurting me, and she kept moving it. And 2 days later, after the surgery, he had a vasculitis in his arm. Right?
Uh,
I said, well, that had nothing to do with it. It was the testosterone, right? Right. And testosterone usually, if it does cause, emboli, it's deep vein. It's not superficial.
yes.
So I told him that go tell them they're all wet. So, but it was easy. It's easy to blame the testosterone, right?
Goodness sakes.
This is the conclusions. Since we're just doing a summary, I didn't go through all of the. I think we have gone through all of the literature, but so the references are here. Okay, if you want,
Yes.
if you can't find them, if you want them again, I'll send them to you. But here are the conclusions. High testosterone levels does not increase the risk of prostate cancer. Um, uh, Therapy does not increase the risk of prostate cancer. It doesn't increase the risk of progression in prostate cancer, and the testosterone does not cause an exacerbation of metastatic cancer, and metastatic cancer uh, with testosterone doesn't cause a rapid progression and death. So most of this work was done by Morgenthaler in New York. Um, but we have here, if you want them, I see I have about 15 references just for this slide alone. So, okay.
Interesting.
Yeah. Okay. This is what to do with with a prostate cancer. So if they have a radical prostatectomy or X-ray therapy, you need to wait 3 months. If you want the PSA low, you want it under one. Usually, if they've given them androgen, blockers, then it's usually 0.1. And I usually start at quarter doses to half doses. And I usually don't bring it all the way up. If you start seeing the PSA creeping up, I'll back off. Not because I'm worried that there's going to be an issue with a recurrence, especially if they've had a radical prostatectomy. The prostate tissue's gone. Although they say, well, there could be a metastasis that we don't know about. But because they'll go to the GP who tells them you can't do that. Um, that's bad. And then I'm sure there are members of the bar who have big billboards all over El Paso, like they do in every other city. Trying to steal your whole uh, your whole estate that you worked your whole life for. Right? So
Yes.
that's the real reason. Okay. Active surveillance means that you don't do anything. So you're just doing PSAs every 3 to 6 months. So you can, you can start right away. You can expect the PSA to rise. If they have metastatic disease, you can also um, uh, expect the PSA to rise. I don't worry about it too much. Make sure you inform the patient that that's what's going to happen, and make sure they sign it so that you have an informed consent there. Okay,
Okay.
so that's what you need to do there. Okay, and then there's the issue with erythrocytosis. You do get an increase in red blood cell count. Again, greater with injectable, the IM versus the transdermals. Um, but you do not get an increase in platelets or white cells. Okay.
Uh-huh.
It's not polycythemia vera. Polycythemia vera is actually on the rare disease list. I mean, everybody knows, testosterone, you're going to get, polycythemia vera. It's not polycythemia vera. It's
Yes.
erythrocytosis. Okay. High blood testosterone levels does not increase the risk of blood tumors, cardiovascular risks, strokes, or blood clots. So, polycythemia vera is an increase in red cells, white cells, and platelets. It is a genetic disease. I think it's I might have it on the next slide. JAK2 or JAK and TET2 genes are elevated in 97% of the polycythemia vera patients. The
Interesting.
erythropoietin levels, you can draw erythropoietin levels. They're high with testosterone. They're low in polycythemia vera. I mean, they're very different. Okay. All you need to do is look at a CBC. So you need the differential. Okay. If the platelets and the white count are normal, you don't need to send them to the hematologist for a bone marrow, which I think they stopped doing it finally at the VA. I kept telling them every one of the VA guys that would come to me, they'd end up sending them if remember we're up in the mountains here to begin with. The valley floor here where I live is 4,500 feet. And if they live up in Truckee, at the lake, it can go up to 7,000 feet. So
Wow.
hemoglobins are higher here to begin with. Even the labs here will say 40 to 50, not 35 to 45, like back home or at sea level. So So 52, 53, that's not a big deal. Um, Theoretically, you don't even need even if they get higher, 55, you don't really even need to do anything about it. Remember, Lance Armstrong's hematocrit was 70.
Wow.
Yeah. So, but guys tell me that, if we do a phlebotomy when they're at 55 or higher, they tell me they feel lighter.
Mhm.
Um, it's kind of a heavy feeling. We do it in the office now because they give them they give them such grief at the drawing centers, or even that the plasma centers here won't take them if they are on testosterone. Um, the hospital will do it, but they make them fill out a 20-page paper, and go through all this rigmarole. And they said we charge them $75. It takes 10 minutes, finish business, and off they go. So it's
How much do you draw off?
a unit. We get from Shine. You can get a unit draw bag with, it comes with a, phlebotomy kit. Comes the needles all attached. You tear it open. The bag's there. It's attached to it. It's a pretty big gauge needle. I think it's a 20 or something. Um,
Yeah, they tend to be pretty big.
yeah, and you draw it off and send them on their way. I got one guy keeps passing out though when we do it. Twice he went out cold. So okay, estrogen. So that's testosterone. Okay, estrogen, devil or angel. And again, lots of myths. Estrogen has 400 functions. The more important ones are in blue here. Think estrogen drives blood flow to the brain. I mean, that's actually for guys, that's the most important, and women too. Estrogen gives women their female characteristics: the shape, hair, nails, skin, voice. A good amount of estrogen is a gal who's going to be what we call in Yiddish zoftig, well endowed, and
Yes.
estrogen decreases plaque formation, increases collagen in the skin. If you ever go into a nursing home and go into into the lunchroom there, and you see all the ladies sitting, the women there, the ones that are sitting up playing mahjong and they have nice smooth skin, and they're either the cute old ladies. Those are the ones that add hormones. The ones, even synthetic ones, the ones that are slumped over and they have osteoporosis, and they can barely pick their head up, and their skin's all wrinkled, and they're right, and they're miserable as anything. They didn't have hormones. It's pretty clear. I don't know if you ever go to a nursing home, but it's pretty clear.
Yes.
You know,
Occasionally.
I mean, you just go sit and you don't even have to talk to them. You can tell which ones, had them and which ones that didn't. Um, and decreases blood pressure, lowers LDL cholesterol. It actually controls triglycerides also. Improves reasoning and new ideas, energy, strength, mood, bone density. What my acupuncture teacher would call good stuff. Okay.
Hmm.
Reduces overall cardiac risk by 40 to 50%, particularly within the first 10 years of menopause, if we get them some estrogen. It aids in neurotransmitter in the brain, such as serotonin. And a lot of the antipsychotic medications actually have estradiol rings in them.
Ah,
So there's a
interesting.
lot of estrogen type rings. And of course, osteoporosis. Okay. And deficiencies, you get hot flashes, night sweats, brain fog, belly fat, poor memory, loss of breast tissue, um, amenorrhea, thinning skin, and wrinkles around the mouth. So wrinkles around the mouth, you'll see, and especially that when they start going, they've been in menopause for a few years, comes from two things: smoking
Yes.
and loss of estrogen.
Sylvester.
Okay, diabetes, blood sugar abnormalities, elevated lipids, and heart disease without estrogen. So this business of, well, we'll give the patients estrogen for the first 10 years after menopause, but after that we take it away. Where the hell does that come from? I said, then what? Right?
Yes.
Well, we can give you bisphosphonates for your bones, and we can give you We can give you ADHD drugs for your brain, and we can give you, just go down the list, right? We give you
Right.
statins, and we'll give you beta blockers for your heart, and it's ridiculous. I mean, I don't get it at all. Now, too much estrogen is also a problem, especially in the younger population. And again, a lot of this comes from birth control pills and
Yes.
endocrine disruptors. So, one of our biggest endocrine disruptor are plastics. These girls go to aerobics class, and they got a 32 ounce Coke bottle that they're drinking water out of, right? And so, I mean, I'm guilty of it too. We have a water thing here, and it's the big 5 gallon plastic water bottle. So that's our clean water here. So you get fluid retention. Estrogen causes cysts. Okay, so cysts
Yes.
in the organs that are affected. So the breast, the uterus, and the ovaries. So ovarian cysts, uterine cysts we call fibroids. Uh, endometriosis. Those are basically non-functioning cystic tissue on the endometrium, and gallstones are cysts in the gallbladder. Okay, and that's two.
Okay.
And a lot of times patients will come in, she's 40 years old, she's got irregular periods, her breasts hurt, she's got low breast lumps and breast cysts also. She's got fibrocystic breast disease that comes around a week before, whenever she's having her cycle, which could be every 12 days now or every 40 days now. And oh, I had my gallbladder out 10 years ago.
Yes.
That's pretty classic. And so, did you have a mammogram? And these are the mammograms that will read dense breasts.
Yes.
Okay, dense breast is estrogen excess. Um, and gynecologists, this is all they do, and they don't get it. I don't understand. They do not get it. Have you ever talked to anyone about any of this stuff or dealt with them? Right?
Yeah.
It's like talking
So-
to I said it's as plain as day, at least to me. I don't know.
yes. Yeah, they're brainwashed.
Yeah. Weight gain, especially in the middle, that's an increase in estrone. Remember, there's three types of estrogen, one,
Yes.
two, and three. Estrone, that's the bad guy. That's where they get the weight gain in the middle. And remember, we use 7-keto DHEA that binds the estrone. And you end up with it has a weight loss component to it. Okay. And breast and men, you get breast tenderness, breast proliferation. You can get gynecomastia, prostate enlargement, and increased emotional lability and tearfulness. Or as we put it, politically incorrect, whining like a girl. Okay. That's not politically correct.
Yes.
Okay. So that's estrogen. Remember, we're just doing a summary here. Okay.
Yes.
Progesterone balances estrogen. Basically, that's his main purpose. I always liken to. Do you remember the honeymooners? Remember
Yes.
Ralph Cramden? He was always getting himself into trouble and get rich quick schemes, and he was always he was a blowhard, and he was a big fat guy. So estrogen is Ralph Cramden is estrogen. And you remember Alice, his wife,
Yes.
got him out of trouble? That's progesterone. Okay. And nobody under 50 knows who Ralph Cramden is now. I have to come up with a better analogy now.
Right. I know. It's like
They
telling
don't know who it is.
Ike jokes. Nobody gets it.
Yeah. So progesterone improves sleep, has a calming effect, lowers blood pressure, helps eliminate fats, lowers cholesterol, balances fluids, increases metabolic rate. It's a diuretic. It's a natural antidepressant, is an anti-inflammatory. We're using progesterone more and more now. This is actually one of our when we did so young guys, we don't want to give testosterone because it causes kills sperm. Under 40. We're actually using progesterone now. There are progesterone receptors in the Leydig cells, which produce testosterone.
Interesting.
So we're using it as a nose spray. Um,
Some are using it intrajoint
yeah.
too. Have you ever?
I haven't used it in a joint yet. We've been using the BPCs, we've been using the peptides, so
Uh-huh.
yeah,
Okay.
they work
Gotcha.
quite nicely. Um, but I can see it, for head injuries, if
Yeah.
IV 8 milligrams per kilogram of progesterone within the first 24 hours of a traumatic brain injury decreases mortality and morbidity by up to 50%, if you compare it after about 30 days. So those of you in the ER, you may want to take a look at that.
500 milligrams
800 milligrams,
progesterone.
8 milligrams per kilogram.
Wow.
So, so if you weigh, 200 pounds, that's about what, 90 kilograms about.
Yeah.
So
Mhm.
9 times 8 is 72 kilograms. That's per hour. Okay. For 24 hours.
Really? Oh, you continue it per hour for 24
For
hours.
24 hours. Yeah. Okay.
Goodness. Okay.
Yeah. Um,
Yeah,
uh,
they aren't going to do that.
yeah, I know. There are studies, though. You know what? There was there was a phase 2 study that was very successful. So of course, like with the ivermectin, instead of doing a phase 3 with 8 milligrams per kilogram, they used 4 milligrams per kilogram, and guess what? It didn't work. Big surprise.
Interesting.
I said, if I give you one penicillin pill a day for a strep throat, that's not going to work either.
Interesting.
You need
So
40.
you think that they structured it so it didn't work?
Yeah. Mhm.
They
Just
don't
like
want to
that.
prove it.
Yeah, like the ivermectin. Okay, we'll do ivermectin studies. So we were doing. I don't remember what the dose was now. So we were doing on average, for women 12 milligrams a day, and for men 15 milligrams. It was per kilogram, but escapes me off the top of my head at the moment. For 5 days, and then once a week after that as a maintenance. That's what we were doing during COVID. So ivermectin doesn't work. So they did.
That's right.
They used 3 milligrams twice a day. So 6 milligrams was the max they used for 3 days.
Interesting.
So there's a theory here that's, pretty well documented, that it's not the excess estrogen that causing cancers is actually a progesterone deficiency, and that's
Okay.
why we measure the estrogen progesterone ratio. Okay.
Yes.
So this was a study done over 33 years, believe it or not. Uh, so infertility with luteal phase defect and progesterone deficiency. There were 10 times the deaths from all cancers, and 5.5 times deaths for premenopausal, 5.5 times the incidence of premenopausal breast cancer with low progesterone and
Wow.
normal estrogen or estradiol levels.
Yes.
Okay. So, and progesterone, remember, I was OBGYN resident. We would do a hysterectomy, and then we would give the patients Premarin, the synthetic estrogen, and tell them you don't need progesterone anymore because you don't have a uterus. That's what we would tell them.
Yes. Oh, yes. Hmm.
So,
Do they still say that now?
yeah.
Do
Yeah. I mean, I got students coming in and they still say that. So again, so here's a summary. Progesterone, agitated, irritable, can't sleep, poor libido, headache, short temper. These last four here are actually the same as estrogen excess. And, you can pull out a package insert and see progesterone deficiency, and that's what you get. But bloating, bone loss, osteoporosis, uterine fibroids, and menstrual bleeding, decreased HDL. This is technically high estrogen, which is low
yes.
progesterone.
Hmm. Yes.
You don't usually see estrogen or progesterone excess unless we're treating somebody and we kind of overshot the mark.
Yes.
Occasionally, when they start taking progesterone alone, they'll get worsening hot flashes. Um, and so what we'll do is we'll half the dose, and then we'll use I'll use either a vaginal estrogen, or there's even an injectable. The compounding pharmacy will make an injectable, a once a week injectable, and we use like 2/10 of a cc, and then that usually takes it away.
Injectable
Estradiol,
progesterone.
estradiol.
Oh, I see. Okay.
Yeah, there are injectable progesterones, but we don't usually use them. There are synthetic ones.
Okay.
There's one of the birth control synthetic progesterones, which is it lasts 3 months as a depot progesterone, but it makes them
Yes.
crazy. I had a lady friend who was doing that, and she was nuts every time they gave it to her. um, they feel so. The one side effect is that you will see is they feel drunk or hungover, and they're excessively sedated. Make sure you dose it at night. Can get an increase in carbohydrate cravings and appetite. This was from that lecture that I did on progesterone after hysterectomy. The reason not to use it is because they can't get pregnant. Okay, so you don't need it. The reason to use it are all of these things. Okay, so decreased breast cancer risk, memory loss, slowed process, thought process, mood changes, impulse aggression, stress, suicide ideation, insomnia, emotional flatness, um, neuroprotective, positive association with memory and cognition, immune suppression. It reduces neuronal loss and traumatic brain injury. It regulates GABA glutamate balance in the brain, improves thyroid function, relaxes smooth muscle, raises basal body temperature, sedative effects, improves visual memory, increases diuresis. Um, we actually have been using it. We have a lady in the not in the where she's in New Zealand. She's got a hydrocephalus, and they don't want to operate her on her. She's in her 80s, so they're just gonna leave it alone. Not a hydrocephalus. She has a maybe it is a hydrocele. I have to go look it up. Anyway, we started giving her progesterone, and we gave her pretty high doses. We gave her like 400 milligrams twice a day, and kind of knocked her out. But we did that for 4 weeks, and then we're down to 400 at bedtime now. So she sleeps a lot, but it's actually actually decreased the fluid in her brain. Um,
Really?
Actually going down. Yeah, the hydrocephalus is down about a quarter. So she's in her
The
she's in
the
her
head
80s.
injuries, head injuries. You mentioned the IV. Will you give it orally in like less severe people that
Yeah,
would be in
once
home?
they're out of the out of ICU, you want to continue it for at least 4 weeks. Okay.
Yeah, high doses. I mean,
Yeah, pretty high
twice
dose.
a day.
We'll give them 200 to 400 milligrams. If 400 would be better, as long as it doesn't make them too sleepy.
Gotcha. Okay.
Okay? And it's actually okay for men also.
Okay.
Do growth hormone, and then we'll quit for today. Okay.
Okay.
The growth hormone, remember, is 191 amino acids. They're linked together in a specific pattern. I always put the windmill or the car. If you get if you buy a box of Legos and it has the car on it on the cover, and it's 191 pieces, and if you follow the instructions, you get the car. Um, if you want to fool around with it, or you got a little kid and they want to do something else with it, you can make a cart out of it. You can make a building out of it. You can make a tower. You can do other things with it. Those are peptides.
Uh-huh. Okay.
So you can take pieces of the growth hormone, 191 Legos, and take, say, 20 of them or 29 of them, and you can get partial growth hormone. And those are the
Okay.
peptides. So CJC 129, 1295, Semerelin are the first 29 amino acids of the 191. Okay. Growth hormone stimulates growth and cell reproduction. Um, the main thing that we look at, remember, that's the stuff that the athletes took so they could hit 75 home runs when they were 45 years old, which is not natural. So you do get strength and energy and sense of well-being. The main thing that we look at is what's known as executive function. So the ability to perform tasks.
Uh-huh.
Okay. It's an anti-inflammatory. It reduces interleukins 1-6 and also C-reactive protein. And it's for memory, concentration, paranoias. And then again, so this is executive function, task initiation. So starting projects easily or not, finishing projects easily or not, multitasking again, easily or not. And then things like obsessive compulsive tendencies, dark moods, paranoias. Those are the things that we really look for as far, as growth hormone. Remember, we use IGF-1 as kind of a screen. growth hormone draw levels are kind of volatile. They're difficult to get. The technician has to make sure that the cells don't get the tube doesn't get shaken at all. And you have to run it within like 20 to 30 minutes of drawing the blood, or it's not accurate. So the IGF-1 is much more accurate um, uh, 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 blood test.
Okay.
Okay, how we doing here? You want to do thyroid, or are we good for now?
We're good for now.
Okay, all right, all
Very
right.
good.
So that was
Back to clinic today.
yeah, at 9 o'clock. It's my time. So
Okay.
yeah, uh,
Fantastic.
yeah.
I need
Okay,
to pay you. And
yeah.
anyway, for
Okay, yeah. So
so my
next
apologies.
week. Yeah, I should be around. I'm okay for next week. I'm
Okay.
leaving Wednesday night for A4M. I'm going to for the big anti-aging conference in Las Vegas every year.
Good.
So
Okay.
okay. Um,
Thank you very much.
yep, send me messages if you have questions or whatever. Okay.
Gotcha.
And
Okay.
the video from last week for some reason didn't get processed. So I started processing. I didn't notice it till this morning. So I started processing. So I'll send you that one probably as soon as I hang up. Okay.
Okay.
And
Great.
we'll get you this one whenever. Okay.
Thank you.
All right. Thank you. Okay. Have a good day. I'll see
You
you.
too.
Okay. Take care.
Bye bye.
Bye bye.